you can ask these simple questions to the AI and it will come up. And you can always, it's all about the prompts when you're talking about AI. And, a lot of people talk about ChatGPT. I think Gronk's probably a little bit better. But, you can.
Which one is Gronk again?
Gronk is the one by Elon Musk.
Oh, yeah.
With X. And the interesting thing about that one is that ChatGPT only scours the internet and gets those answers and, questions, whatever you're looking for. It only does it through what's going on with the internet. Now, Gronk obviously does that too, but interestingly, it also gets into X and even earlier when it was Twitter. It gets in there and it works on what people are saying that are actually know what they're talking about. Because there's certain doctors that have done crazy amounts of research in a particular area. And so with Gronk, and this is the only reason I say it's better, it not only gives you what the internet says, but it also gives you very educated responses from people that kind of know what they're talking about. Now, you can take that for what it is, and that's the whole premise with AI. A lot of people say, I'll take AI. And most of the time, AI is right. But what people don't realize, especially when we're talking about healthcare in AI, and it's going to change healthcare, like it's already changing healthcare. It's really going to change healthcare over the next, even over the next 5 years, but definitely over the next 10 and 20 years, that you have to take it with a grain of salt, because this goes back to Dr. Google. People Google certain particular things. And now it's going to give you every good and bad thing out there.
Yeah.
And we in our minds as humans, we go right to the bad thing.
Hypochondriac.
Yeah. And you're like, I can do this, or I can get this. Is that a possibility? Yes, because somebody, somewhere, sometime got that negative effect. And, by law, you have to say that, especially the different companies that have different medications and things of that nature. But there's certain protocols that these particular AI, and I include Gronk, I include ChatGPT, I include all of them in there, that they put in. They give you all the information. And if you're not educated enough to kind of decipher that particular information correctly, you can hurt yourself more than you can help yourself. And so that's why I always tell people, all of the stuff that we talk about, it's great, but you have to talk to if it's dealing with healthcare, mind you, or your health, you have to talk to your doctor that treats you and that knows you. Whether that's a cardiologist, a primary care doctor, maybe it's a functional medicine doctor, maybe it's a naturopathic doctor. It's somebody that knows you, has been treating you for a while, and knows how your body is going to respond to these type of things. And so that's why AI, it's going to be so amazing, because already now who I'm scared with for, especially in medicine, is the radiologist, because already, and AI is not even anywhere near where it's going to be literally in the next 2 years, much less 5 or 10 years.
Is this regarding the article that we talked about today?
Well, that's one aspect of them, but that was more that had to do with cardiomyopathy and cardiac events in people with cardiomyopathy. That was AI kind of figured that out prior to it happening, and so those people were able to get treated or have more tests, more extensive tests, more so than the other ones that didn't have, that AI said, no, they're doing
let's
okay.
Let's start one at a time, one in the other, because we have enough time today to go deep dive.
Yeah.
So let's just go with what you were saying about radiologists, and then after that, let's talk about.
Well, the only point about that is who I fear the most or the soonest that could be affected by AI is by way of physicians are the radiologists. And the only not the interventional. You're not going to have any AI anytime soon because the robots aren't that good yet to stick a needle in somebody's spine or to treat somebody's neck with a certain injection or something like that. So not those type of patients that do a lot of intense and I talk, I include myself, thank God, because I do a lot of pain management and regenerative medicine, but also like the aesthetics, the liposuction and things of that nature. AI is not going to take that away anytime soon. All the surgeons, we need them. We need their hands. Okay. But radiologists, especially let's say a good old fashioned general radiologist that reads CAT scans, MRIs, and regular plain films, those particular specialties and some of the more subspecialties, neuroradiologists and things of that nature, they're going to have some issues probably sooner than later with AI, or let's say they're a larger hospital company or whatever company they're with, going to those type of systems, because it's already slowly proving that it can find issues with a patient from seeing a generalized scan years before it's going to get worse.
Yeah. Can we
that's the article
break
you're
it down?
to. That's a different article, but there was an article that came out, I want to say 4 or 5 months ago, that showed that the AI, it was an AI, it wasn't a true software just with AI, but AI was a part of the software, I should say. Anyway, the AI component of it was able to look at a plain film as well as standard mammograms. And what the human radiologist said, oh, that's normal. The AI said, yes, it's normal right now, but in approximately 2, 4, 6, 10 years, this area here and this area here might well develop into a breast cancer. And so they reviewed those. They took biopsies of those particular areas that AI said, and lo and behold, there was cancer there. It didn't grow to a point that you could tell.
So did the article say how it learned, like how to detect that early?
You have to understand these AI, especially the AI software, that it's just not your standard ChatGPT and Gronk. It's not like that. These are specific softwares that utilize AI to find a very, very specific thing. Like they're looking at mammograms or MRIs or whatever. And they don't just say, look at standard MRI and say, what do you find? They're like, what does this mammogram show in dealing with breast cancer? Or maybe it's a particular stage, a particular type of breast cancer. But the unique thing is it's all about how it's programmed. And the AI, the beauty behind it is it continues to relearn. And if it misses something, it won't miss it again. And so it is constantly learning. And so obviously we as humans, we do that too. And as a physician, we have to take, continuing medical education, CME credits every year to maintain our license, maintain our certifications and things of that nature. But we can't hold that much information and retain it and bring it out when we need it all the time, unless you have a photographic memory. And I've only known a couple of people in my life that had true photographic memories, it's astounding to see how these people work and how their brain works. It's much like an AI type of software would work. But I can count on one hand how many people there are, at least that I know. And there's just not that many people that are that bright. We're all bright and our brains work great, but we just can't access that kind of memories. Even the guys that are very, very bright, they study for a test, they get all this information. As soon as they pass the test, that information is gone. It's in their head somewhere, but they can't retrieve it again. People with photographic memories, they can retrieve it a lot better.